Good evening and welcome. I'm Greg Silverman, the Executive Director of the Westside Campaign Against Hunger. For those of you who were in our VIP hour for their virtual Fall Harvest Dinner, welcome back. For those of you who are just joining us at the main event of our virtual Fall Harvest Dinner, welcome. Each year we host our Fall Harvest Dinner in the basement of St. Paul St. Andrew's Church, where we've been based for over 40 years. This year, you're at home, and I'm here in the sanctuary of St. Paul St. Andrew's Church, a space that we needed to take over starting in March to get more warehouse space to be able to serve more people the important foods they need. This room became a space where we were packing whole grains and proteins for tens of thousands of people on a regular basis. Westside Campaign Against Hunger, for those of you who don't know, is one of the largest emergency food providers in New York City. And we've been at the forefront of innovation in emergency feeding for over 41 years. We started out as a pantry here in the basement of this church. We invented a model called the customer choice model, a supermarket-style pantry. What does that mean? It means we created a free grocery store where people shop for healthy food, the foods they want for their families and themselves. So for almost 40 years, we did a great job of bringing people to healthy food. 3 years ago, we started a mobile pantry. And what that idea was instead of bringing people to food, we would bring food to people. So over the last 3 years, we've had dozens of partnerships opening up mobile market sites in northern Manhattan and the Bronx to bring food directly to people where they live, where they learn, where they play. Most recently, through growing partnerships with our mobile efforts, we partnered with New York Presbyterian Hospital to address food insecurity across New York City. Whiska's now, thanks to our partnership with NYP, is serving communities in Queens, Brooklyn, Lower Manhattan, as well as continuing efforts in the Bronx and Upper Manhattan. Last year as well, we kicked off a collective purchase model with some of the largest emergency food providers in New York City. Basically, we wanted to get the best food for the best price for the most people. So with our other partners around the city, we shared data and we talked to distributors and we drove prices down, and across 4 organizations, we saved almost 20% on our food purchasing, which led to lots more healthy food for lots more people across the city. We've doubled the number of partners in this collective purchase model, and now we're talking to even more community groups that want to be a part of this because we know we can drive more change by driving dollars down to bring more healthy food to people in need. And during COVID, much changed, but we stayed true to our mission. We had some new partnerships, such as with Bellevue Hospital, where we worked together to ensure that 3,500 patients, when they were discharged from recovering from COVID, received a box of healthy food so that when they went home, they had the healthy food they needed to recover. We also partnered with Children's Aid to make sure that children in disadvantaged communities in the Bronx would have access to the healthy foods they needed when their schools were closed and their families were at home. We wanted to find more ways to people to access healthy food where they are. Through the entire crisis of COVID since March, we've had to adjust many parts of our models. Our social services are virtually and are virtual. Many of our programs had to either were shuttered or transformed. And we realized early on that a lot of our seniors weren't showing up. So we partnered with DoorDash and United Way and more recently with Uber Eats. And we started delivering the food directly to seniors' homes so they could get the nourishing food necessary to not just survive, but to have joyful meals and to be healthy, not just in a pandemic, but in the future as well. It's been an unprecedented time for all of us. And our communities pulled together and supported Whiska's mission and core values of dignity, community, and choice. Whiska, the team, the collaboration, the innovation, it inspires me every day. And it's what drives everyone on my team's work. So we're going to move on in our event tonight, and you're going to be hearing from Rabbi Levine from Congregation Rodeph Sholom, a key partner of the Westside Campaign Against Hunger. You're going to hear about program highlights from Whiska and from many of people on our board and other members of the community. The program will also feature a live text to give which is happening now, and we'll follow the thermometer as the dollars raise. Hopefully we get to $250,000, so please donate generously. And text WSCAH to the number 56512. Thank you so much.
Good evening, and welcome to this year's annual Harvest Dinner. My name is Robin Huffman, and I'm the chairman of the board of directors for Westside Campaign Against Hunger. It's humbling to be with our community of supporters this evening. As for many years, we've gathered together sharing a meal, and tonight we're gathering in a new way to support the incredible work of the Westside Campaign Against Hunger, where I'm proud to be the board chair. The Harvest Dinner is one of our most critical evenings of the year. The funds raised tonight support the programs that serve our fellow New Yorkers. Our food program, in which WSCA distributes healthy food at 21 sites across the city. In Manhattan, at our historical home on West 86th Street, in Washington Heights, the Bronx, and now through an expanded partnership with New York Presbyterian Hospital, through the Lower East Side, Brooklyn, and Queens. This citywide expansion brings WSCA's commitment to ensuring that food insecure New Yorkers have access to the healthiest food possible. This partnership lets WSCA showcase our leadership and best practice work while reaching more New Yorkers in need. This past year, WSCA has served over 20,000 households, which reaches over 35,000 individuals. This is a 71% increase from last year. WSCA has also distributed 2.2 million pounds of healthy food, a 33% increase from last year, and 47% of that was fresh produce. Incredible work by the entire WSCA team. So thank you to every individual in this room for gathering together tonight with us from your homes and supporting the mission of this vital organization. We simply cannot do this work without you. I hope you enjoyed tonight's program, and thanks again for your continued support of this incredibly important work. I'd especially like to thank WSCA's Board of Directors and Advisory Board for all the support as WSCA continues to innovate through its best practice model and citywide expansion. City Harvest, for your partnership and support in accessing healthy food. Food Bank of New York City. Robin Hood Foundation, for your long commitment to supporting our mission. Bank of America, one of our largest volunteer groups and the provider of generous COVID-19 relief funding this year. New York Community Trust, for your support of our collective purchasing pilot that we'll hear more about tonight, and for your COVID-19 relief funding. Helmsley Foundation. Your initial funding of our mobile market 3 years ago clearly gave WSCA the catalyst to be a change maker across the city, and for your COVID-19 relief funding. Other key foundations who have made and make our work possible: the Tiger Foundation, the Rosenthal Foundation, the Spirit Foundation, the Voss Foundation, Van Amerlingen Foundation, the Monarch Foundation, the Gottesman Fund, the New York State Health Foundation. I'd also like to say a very special thank you to the Church of St. Paul and St. Andrew, where we would normally be gathering this evening for our Harvest Dinner. SPSA has been our physical home for WSCA and its original West 86th Street market site, where our customer choice model pantry originated. St. Paul and St. Andrew has gone far above and beyond in their support of WSCA, particularly since the onset of the pandemic. SPSA generously provided WSCA with access to nearly its entire facility during the depth of the crisis, including using the sanctuary as a packing facility, thereby allowing WSCA to ensure that thousands and thousands of New Yorkers were able to access healthy food. Again, our heartfelt thanks to Reverend Kay Carpin and the congregation at St. Paul and St. Andrew for really stepping up and supporting the community in this time. Thanks again to our incredible community of supporters. I hope you all enjoy our program tonight.
The Westside Campaign Against Hunger, as you know, is committed to providing all New Yorkers with the access to healthy food and supportive services that they need to thrive. We're not just committed to doing this for the Westside Campaign Against Hunger's immediate customers, but for all New Yorkers. And to that, we therefore need to start talking about bigger picture issues and often about advocacy and how you can use your voice to make change in the city. Many organizations, Westside Campaign Against Hunger included, receive funding from the City of New York to fight hunger. One of the key methods of this funding is called EFAP, the Emergency Food Assistance Program, and over $20 million is earmarked to be distributed across the emergency feeding network to buy food for hungry New Yorkers. Shockingly, even with many city officials espousing healthy diets, farmers markets, and speaking of how they love to cook, not one penny of that over $20 million is allowed to be spent on fresh produce. Truly an absurdity, especially for WSCA, who gives out 50% of its food in the form of fresh produce, and we believe that's essential. So it's well past time that the city changes this emergency feeding assistance program. So we ask for two things. We're going to be sending out a letter to you that you can sign on in the coming day. In that letter, we'll be asking for an increase in dollars from the city for the emergency food assistance program, because there's more pantries in need that need more funds to buy more food. And we'll also be insisting that the program increases choice. We believe customers deserve the choice of the foods they want, and we believe community organizations as well deserve the choice to pick the foods that their community members want as well. So we are imploring the city to change this program to do what we believe is best practice, allow community members to have the dignity and choice to make the change they want in their lives. It's now my pleasure to introduce Rabbi Levine of the Upper West Side's congregation Rodeph Sholom, a longtime supporter of WSCA. Rabbi Levine is a published author, an inspiring speaker, a teacher, counselor to many congregants and community members alike. He's a clear thinker with an amazing sense of humor, who I've, having spoke at his congregation, have been a part of jokes and stories from. And he's a much sought after speaker in the media for national programs and radio shows. For those of you who don't know, Rabbi Levine, after over 30 years of service, is retiring this coming year. And we thank him for his efforts and are honored to have him be here tonight to give some remarks for us at the Westside Campaign Against Hunger. Following Rabbi Levine's remarks, we'll be featuring a video presentation of WSCA's work. And there'll be words from other board members on why supporting WSCA's work is more important than ever. So we hope you enjoy these remarks. Speak to you soon.
So it is wonderful to be back with the WSCA community. I've been to a number of these luncheons. I've spoken here before, and I want to really highlight the relationship between myself, I'm Rabbi Robert Levine, Senior Rabbi of Congregation Rodeph Sholom, and the WSCA community. We have had a food drive at our congregation for 40 years, and WSCA's been in business for 40 years. So much of the proceeds of our food drive have gone to WSCA over the years. So this is a long-standing and I would say sacred partnership. You've had a number of our members be vital members of your board, most recently Joanna Kapaner for many years, and now Beth Rubin has joined the WSCA board. So this is a wonderful, wonderful relationship, and I'm happy to underscore that. We in the Jewish community just came out of Yom Kippur, and we read it. The entire Jewish community all over the world reads one biblical text from 58th chapter of Isaiah. So what's the point of fasting on Yom Kippur? It's not to sit there and say, there's 5 hours left, there's 4 hours left, I'm starving. That's not the point of the fast, says Isaiah. What's the point of the fast? To understand, to have a feeling inside that there's something that this ritual must prompt us to do. And that is, the meaning of the fast is to bring the homeless poor into your house, as we at Rodeph Sholom have done through our homeless shelter for 35 years to clothe people who need it and to feed the hungry. That is our purpose. And so it's an important thing that we're all doing together. Um, we're here in the midst of a pandemic. I don't have to tell the Wiska family about how urgent uh, needs always are, but there has been close to a 50% increase in the need for food assistance. And statistics tell us that only 11% uh, of these new people are, in fact, homeless. They are people who never needed food assistance before. Now we're told 1 in 5 New Yorkers need food assistance. And so it is absolutely vital that everyone understands what the need is. And I want to just call your attention. There was an amazing New York Times Magazine article about homelessness. And there was a child featured in that article. The young man's name was Prince, and with his mother. And this is a young man who was shuttled from homeless shelter to homeless shelter, instability to instability, school to school, no solid ground under his feet. And what did he keep saying to his mother? Mommy, can you give me something to eat? He was not saying, give me something to eat, because there was a cold, stale bologna sandwich offered to him in shelter registration. He wanted something that tasted good. He wanted something nutritious. He wanted something to stick to his bones. And this poor mother, just trying to navigate the system, couldn't even meet that important basic demand. I come from a tradition. You often come from a tradition, but the Hebrew Bible proclaims that there shall be no needy in your community. I don't think the Bible anticipated the complexity, the denseness of New York City. But the Bible says, you shall not harden your heart, but open your hand. Harden your heart, open your hand. There's one other biblical teaching I want to share with you, which I think its command comes closest to the model and the spiritual model behind the business model that is Wiska. The Bible says when you harvest your crops, assuming that people worked the land in those days, you shall leave the corners of your field. They don't belong to you, they belong to God. So anyone can come and partake of food. You don't own that. So what the Bible is saying is we have yes, we have an obligation to feed people, but we also have an obligation to do so in a way that does not engender shame and humiliation, but upholds the dignity of people. Here's what impresses me about Wiska. First of all, in the way you talk about your clients, they are customers. Who talks about in food pantries customers and clients? Something else that impresses me tremendously is you care not only about good, nutritious food, not just filling food bags, but good food and consumer choice. For many years, I've watched people come into Wiska and they're going shopping. You wouldn't even know that it is a food pantry because they have the choice of what they want and how they want to serve their family. And you, the Wiska community, make the difference between making it through the week and feeding our children and starvation. You are that vital link. And the way in which you have widened your mandate with mobile, with your mobile capacity. Secondly, with entering into arrangements with other food providers so that you can deal with price and you can get the highest quality food at the lowest possible price. Your vision and the vision of Chef Silverman and your entire staff is exemplary, because as I pointed out, the mission is huge. The need is growing. And instead of saying this is well beyond us, and where is the public sector? And we know that government also often is not helpful. We know that SNAP benefits are often cruelly taken away from people, whimsically taken away from people. So your answer is, we know the frustrations, but we're not going to back down from the mission. We're going to continue to serve our customers, our clients, and to bring dignity to all of them, because they are all created, everyone of every race, every creed, every socioeconomic ground, people who would never dream of needing food assistance look to us with pleading eyes. And your answer is, we are here to help. We are, in fact, you are, in fact, God's partners in the sacred mission of bringing food to the hungry, which, as the prophet commanded us to do, is part of our purpose on earth. So I thank WISCA for the invitation today. I thank you for doing God's work. I will pledge that we at Rodeph Sholom will continue to be important partners in this effort. And I pray that one day the needs will be reduced, but in the meantime, I pray that you will go from strength to strength. Thank you very much. And this is Rabbi Levine of Rodeph Sholom.
Good day, my name is Terry Hubbard, and I'm a board member at the Westside Campaign Against Hunger. I'm also a volunteer as well as a customer. To be a volunteer at the Westside Campaign Against Hunger is to be part of a community, not only in my borough of Brooklyn, but throughout the 5 boroughs of New York City. Being part of Westside Campaign Against Hunger, we're able to help all New Yorkers with healthy foods, and not only healthy foods, but essential resources.
WISCA has been working in partnership. We don't do this work alone, even though we have an amazing staff of 27 caring individuals and hundreds of volunteers and thousands of supporters and donors, but it's also key community partners like Northern Manhattan Improvement Corporation, like New York Presbyterian, like our friends at Robin Hood, our partners in religious institutions and schools across the city who have supported us with volunteers, with access to customers, and just being a partner in thinking about how to make change in our city. Day in and day out, our team is on the phone or in person with our partners trying to make change. It's what we've always done, and it's what we'll continue to do in order to make more change and more impact across the city. It's why we built a collective purchase model with 7 of the largest food providers in the city so that we can collectively get the best prices for the best food for our customers, and then we can collectively use our voices and advocate for change. We can collectively think about other ways to engage across the city to make sure every customer, every person in need gets the healthy food that they need and that they want for their families. This isn't about the choices we want to make for ourselves, but we want to give everyone in the community the ability to make the choices that are right for them in their situation, especially in these incredibly difficult COVID times.
Hi, I'm Maria Lisato, the Executive Director here at NIMIC, and we've been partnering with WISCA since October of 2017, and it's been a great partnership. First of all, we recognize that there's a lot of food insecurity in the community, and NIMIC doesn't have the space to do an actual full food pantry. So when WISCA first rolled out their mobile food pantry, it was perfect because they used to come once a month. We provided some of the volunteers who then assisted with community members and helping out with the food. When the pandemic hit, of course, everything stopped, but food insecurity increased. And we recognized that we needed to partner and continue to partner with WISCA Wisca in order to find a way to feed our community members. And so now, since April, we've been doing our food pantry twice a month. It looks different from the mobile food pantry, but the service and the quality are still the same and even better. Partnerships and collaborations are key to the work that we do because we know that as an organization, as a settlement house, we can't do this alone. And it is only through partnerships and collaborating with community members, with other CBOs, with Wisca, is the only way that we're really going to be able to meet the need and really make sure that our communities remain resilient, they remain strong, and now with COVID that we rebuild and recover.
You know, it's interesting that one of the things about Wisca and the work that we're doing with Wisca is completely actually different than the mission of New York Presbyterian, right? Where hospitals are traditionally been around to address health issues that affect our patients in our community. But over time, we've realized that there's more to health than just giving medication and treating patients in the inpatient environment. Social determinants of health have become a huge component of the importance of treating patients in our communities. So addressing social determinants is something that we've have done now for almost 20 years, even before it became really popular. So social determinants of health are things that affect communities that are not directly related to health but have an effect on health. So I'll give you an example. Immigration status could be a social determinant of health. Food insecurity is a social determinant of health. Housing insecurity could be a social determinant of health. All those have a direct effect on the health and well-being of patients, especially in communities of high disparities.
My name is Dolly Meyer. I'm a pediatrician. I do primary care in New York Presbyterian's Ambulatory Care Network. My practice is at Washington Heights. So food insecurity is when families don't have the certainty that they will have enough food to serve their children, or when they run out of money to be able to feed their children on a daily basis, 3 meals a day. When children are food insecure, they cannot learn, they cannot go to school, they cannot achieve their developmental milestones where they're young, but also, as importantly, that causes an enormous amount of stress to their caregivers, and that stress can become something that we call toxic stress. When it happens in the young children, it really impacts the architecture of the brain, and it changes brain development and anatomy of the brain. So children have a different anatomy and different development by the time they reach to their adult lives. So at that point, we heard about Wisca, that they had a mobile market, and we said, well, this would be a fantastic thing to partner with so we can bring the nutritious food and emergency food assistance to the families who live here in Washington Heights. We started what ended up being the beginning of a fantastic partnership in a local church to bring the mobile market to the families. That was a very successful enterprise initially, but we thought we were having a hard time engaging families and engaging the right families. Why don't we just bring the mobile market to one of our primary care practices? And that's where the model of food farmacia developed, where we identified families with children that are 0 to 5 years of age who have food insecurity after implementing a screening in the clinical setting to see whether they would be interested in enrolling in a 6-month program where they would come every 2 weeks to the mobile market that was located exactly at the clinic, which is a place that the families trust, to receive their food. And not only they received phenomenal, nutritious food, but we had cooking demos, and Wisca brought their staff to help patients enroll in SNAP and inform about WIC and all the other phenomenal wraparound services that Wisca offers. That was extremely successful. Families were very responsive, were very grateful. Wisca at the other side was extremely responsive to the feedback that we got from families, making sure that not only the produce was of high quality, but that it was representing the culture of the families that we served. And that expanded to the idea of having mobile markets food farmacias in other clinical practices. When COVID hit, food insecurity in our patient population went from around 28% to 47%, specifically for families with young children. And the hospital committed to increasing the food insecurity work to our other campuses in Lower Manhattan, Queens, and Brooklyn. Because the food farmacia was so successful, and because we have such a strong, good partnership with WISCA, we approached WISCA to see if they could partner with us yet one more time to expand the work. And that's where it's happening now, where we partner with different community-based organizations to work with WISCA to produce food delivery in the different neighborhoods.
We're here in the basement, St. Paul, St. Andrew's Church, where WISCA's been for over 4 decades, and where we have been during COVID every day for 6 straight months since March 13th. Our team has been here in the basement, packing bags, on the street, distributing food, and across streets all over the city, because it's where we needed to be and where our city needed us to be. And what we've realized during this pandemic is we're not just a good organization. We're purpose-built for this moment and for moments like these. Moments where our community calls and demands support, and that we know we can bring it. Healthy food, signing up for benefits, a helping hand, a volunteer opportunity, anything our community needs to make the change necessary for people to have a better life. So as we sit here thinking about making sure we give people the healthiest food possible, it's what we do every day, it's what we'll continue every day, and where we will be now and into the future.
Good evening, everyone. I'm Ivy Newman, a board member at WISCA, and I hope you're enjoying the program this evening and inspired by all the work that WISCA is doing across the city.
Hi, everyone. I'm Karen Sonnet Rosenthal. I've been a board member at WISCA for the past 4 years, and I continue to be inspired by the entire WISCA team and the innovative ways in which they go about doing the work. Tonight, we are trying to raise $250,000 to support WISCA's incredible work across the city and to support food insecure New Yorkers and make sure everyone has access to the healthiest food possible. I know many of you have been donating throughout the evening, but I urge you right now to text WISCA, that's WSCAH, at 56512.
As all of you have seen tonight, WISCA has met these unprecedented challenges with nothing but commitment to hungry New Yorkers. We want you to support our work so that we can continue to innovate and create solutions for hungry New Yorkers.
For over 10 years, I have watched WISCA's efforts in this community feeding New Yorkers. I have been proud for my kids to be part of WISCA's work. I have been proud to be part of a neighborhood that supports its community. And I've been blown away that at day one of the COVID crisis, WISCA immediately pivoted and did what it had to get the job done. This amazing team has moved its operations onto the street. It's built partnerships across New York City. And even when it was a bit scary to be out there on the front lines, they were there every day getting the job done.
Karen, you are so right. It's been wonderful being a part of an organization that is so committed to community-based change. At WISCA, we dream big. The team here wants to do even more, but we're going to need your support to help us do that so that we can reach more people across the city of New York.
Yes, Ivy. So text WISCA, WSCAH, to 56512 right now and pledge your support. $1,000 fills our shelves with cereals and whole grains for 2 whole days. $500 provides food for 1,000 healthy meals, and $5,000 fills our refrigerator with fresh milk that can serve 10,000 people. We would love to see another $5,000 donation. I know you're out there. Come on, pledge it now.
Everyone who's watching, we know that we're asking for $1,000 and $500, but if you can give $50 or even $10, that's good enough. We want 100% participation. So text WISCA, WSCAH, at 56512. Thank you for your support.
Wow. 2020, for many reasons, has been a historic year of change, especially for WSCA. We've transformed our programming, we've served twice as many people, and we've never stopped innovating to help the community. And tonight's a great example of that. You all came together virtually in a totally new way for us to help us raise the necessary funds for the community. We thank you for every dollar raised, for every advocacy letter you sign, for every person who's going out to vote in the coming days. And we just want to say thank you for everything you've ever done and for being with us tonight. We know it's not a normal time, but we know it is continuing to be a time when we need you to be with us to help everyone in the community. Thank you.